Good afternoon, or good morning, everyone. Will DuPree here in the KXAN live studio. Still waking up today, but hope you're all having a happy Wednesday there. We wanted to jump on to share some information about the coronavirus and the local impacts it's still having here in Travis County. We are experiencing a pandemic milestone here, and it's not one that we really have any really good feelings about sharing this morning. But if you take a look right here, Travis County has now reported more than 100,000 total cases of COVID-19. Again, we should point out this is from the beginning of the pandemic and when we started reporting these numbers, but we crossed that threshold yesterday. Currently, there are more than 2,700 active cases of COVID-19 in our area and 928 deaths to date. Additionally, yesterday, the Travis County Commissioners met to talk about incentives for people to get vaccinated, and here to cover that and talk about it with a little more depth is our KXAN digital reporter, Grace Reeder. Grace, thank you for being here.
Absolutely, anytime.
All right, and as one of our coworkers pointed out, it's the Will and Grace show this morning, so we'll take that with what it is. But Grace, I want to really focus in on what that vaccine incentive program was. You sat through the entire Commissioner's Court yesterday. Tell us what they ultimately decided to help try to get people that COVID vaccine.
Well, of course, at the beginning of those meetings that they do jointly with City Council, we hear about the update from Dr. Walks, and we'll get back to that, but that's really what's driving this vaccine incentive is the new numbers that we're seeing right now, and really the main overall theme at all of these meetings has been the vaccine is the best way to prevent serious hospitalization or death. And so Travis County last night voted and said that they are going to incentivize county employees to go get that vaccine. This plan originally started where people who had already been vaccinated do not qualify. However, County Commissioner said last night they don't want to penalize people who have already gone and gotten this vaccine. So as of now, the way that the plan stands after being voted on last night is that anyone who is an employee of Travis County who has gotten that vaccine and who gets it by the end of October will get 16 hours of paid time off. On top of that, people who join the county within that time will have 45 days to get that vaccine. They will also get those 16 hours.
And let's talk about the cost of this. How much did they kind of set aside to be able to provide this incentive?
Well, they don't really know, but sort of as a ballpark, they're estimating about $4 million for this. They said it sort of depends. They don't have any way right now in the county of determining how many people are already vaccinated among their employees and how many people they can anticipate. So that $4 million is if every single county employee went and got vaccinated.
Okay, and how is this going to retroactively apply to people who already got their shots?
So people who already got the shot apply for this. They'll get that 16 hours. They're going to open up that portal at the beginning of September, and they say that they've been very vocal with employees about what's going to happen. They'll continue to do that so employees know where they go get those hours. But yes, people who have already been vaccinated who are county employees will benefit from this.
All right, everyone, if you're just joining us, Grace Reeder is one of our digital reporters here at KXAN, and she's talking about the latest developments that came out of yesterday's Travis County Commissioner's Court. We should also point out, as you mentioned, Grace, that Dr. Desmar Walks, the health authority for Austin-Travis County, gave an update to both the Austin City Council members and the county commissioners talking about the latest with the coronavirus. She really drilled into this particular action about how COVID is infecting schools. There have been a number of infections related to schools starting again.
Yeah, that's right. That was really the big theme yesterday, was that while these case numbers are already so grim and what we're seeing in hospitals and in ICUs is already something that we really don't want to see, it's only going to get worse based on their predictions because of what we're unfortunately seeing in schools. And over the past 2 weeks, it has been that they've seen an additional 414 reported cases that are school-related here in Austin-Travis County. Dr. Walks, the local health authority, as you said, says that really it's up to school districts right now to implement those COVID-safe practices, but that they have been talking really closely with our local school districts to, let them know that this is happening and to give them those best practices.
Dr. Walks also shared this graphic during her presentation, and what we wanted to really point out was that graph that's on the left-hand side of your screen there. That spiking number, obviously it was pretty flat because school simply wasn't in session, but we're seeing that increase. It is nowhere near where that peak was back in, January and February earlier this year, but we are kind of trending up in that direction, which is concerning for local health experts.
And I think it's important to point out in that graph that we've only seen 2 weeks of school here.
Right.
And so those case numbers are going to be delayed. And so it's very possible that we end up with a peak as we saw earlier in the year, because again, those numbers take a little bit of time to come in as people get tested. There's delays in that. So we very well could see that moving forward.
We also want to discuss the hospitalization numbers here locally. So again, we mentioned that Travis County surpassed that 100,000 total case count yesterday, but additionally, they shared these numbers right here: 646 hospitalizations related to COVID-19, 231 people currently needing that intensive care, and 163 requiring ventilators to help them breathe after they contracted COVID-19. What did Dr. Walk say about these particular numbers and how they're trending?
So these numbers are higher than we have seen at any point in this pandemic, and she said that it's really concerning, specifically that ICU number that you're seeing on the right middle there, that 231 number. We have exceeded that ICU capacity that we have here locally, and we're hearing stories from folks, trying to bring their loved ones to get some of that care and not being able to find it. And the worst part about this, perhaps, is that it's not just here in Austin, Travis County. This is happening statewide. And so while usually in ICUs and in hospitals, when you don't have room, you transfer someone to another hospital, hospitals in our state and frankly nationwide are full enough right now and have little enough staff that there's really nowhere to transfer people to, which is obviously an issue.
Dr. Walks also discussed the vaccination numbers that are being reported, and what we are seeing, and it's an encouraging sign, is that those numbers are going up here recently.
Yeah, they're going up a little bit, 1% increase for people here in Austin, Travis County who have gotten that first dose. So that means people that were fully unvaccinated to this point have taken that first step to go get vaccinated. That's really encouraging, but it's not enough. There are still, I think it's 250,000 people who are unvaccinated here in Austin, Travis County, and that number alone is enough to progress this pandemic. And I think it's also important to remind people that not only does that vaccine protect you, protect the people around you, but when we talk about these variants, people who are unvaccinated sort of help foster additional variants down the road. These pandemics and these viruses adapt to the situation that they're in, and those unvaccinated people are what really not only allows that to be created, but also passes it among the community.
I remember also hearing something related to some of the city council members asking about ventilator usage here in our area and the concern that there may not be enough. Can you speak to that at all, about what Dr. Walks and how she addressed that?
Yeah, so ventilator use right now is high. Dr. Walks really talked about, though, like the issue that they're having most is staffing. So you can't use that equipment if you don't have the staff to provide the right usage. And so we are really seeing a staffing issue here in Austin, Travis County and statewide. And there have been a number of medical professionals who have come from out of state to help us, and that has certainly, even just a few folks is certainly helping, but it's not enough, to the point where even though the local health authority would like to open up one of those field hospitals, we just don't have the staff to do it.
Did Dr. Walks mention anything about how many out-of-state help or additional resources have come in? I know that she mentioned that at the end of last week during that weekly briefing about COVID-19 that they're now going to bring back. Any updated numbers about that?
She did not give numbers yesterday. Yeah. We have to reach out to specific hospitals to be able to get all of those individual numbers. We've been regularly checking in with them to try and get that data. We do know, though, that there are people who have stepped into our state to help.
And it is seemingly very, very beneficial to their operations there, as we are reporting more hospitalizations. Again, as you saw right there on your screen, 646 people currently hospitalized and 231 in intensive care, 163 requiring breathing machines to help them at this point. Grace, is there anything that we didn't get a chance to touch on that you wanted to kind of mention and discuss about what was mentioned during yesterday's briefing?
Well, I think it's important. One of the things that I got a number of emails about yesterday was people asking about, at the beginning of this pandemic, health leaders were saying that kids were less impacted by COVID-19 than people who were older than them. So they're asking, well, why now are we worried about schools and worried about kids in schools? And I think it's important to note two things. First, Dr. Walks gave some really good context yesterday, and the context is first and foremost that last year there was a delay in schools. Everyone was wearing masks, kids were very much virtual, and many parents had pulled kids out of activities that they're now doing. And so we were not seeing transmission among kids and could not get that real data as to whether kids could transmit this disease to others or not because they were not doing anything. So we're seeing that now, and on top of that, we're obviously now dealing with the Delta variant, and studies are still being done to figure out how severe the Delta variant is for kids, but we certainly know that the Delta variant is more transmissible, it is more contagious, and that kids are spreading it in our local schools.
As we were seeing with those increasing numbers of school-related cases here locally, again, as Grace mentioned earlier, 414 cases reported in the past 2 weeks from schools here in Travis County. So again, that is something that is concerning to health experts, and they do mention again that it's really important about mask wearing inside school buildings. Yeah,
that's one of the biggest things that they're asking right now. Outside of schools, the real message is get your vaccine, but inside schools, there are kids, specifically in those elementary schools, who are 12 and under and therefore do not qualify for a vaccine. So we know the best line of defense for those kiddos is to wear that mask and for the folks around them to also be doing so.
Again, Grace Reeder is one of our KXAN digital reporters. She has been covering extensively the coronavirus impacts recently here in our area, and we appreciate all that work. Grace, thank you again for joining me this morning. We really do appreciate it.
Absolutely.
All right. Well, again, you can read more about Grace's reporting that she has done extensively about this very topic over on our website, KXAN.com, and it's also available on the KXAN News app, so please download it if you haven't done so already. Once again, I'm Will DuPree in the KXAN Live Studio. Thank you all for watching. We'll see you back here another time today. Please, everyone, stay safe and healthy out there. Take care.